Welcome back to Dr. Grandpa, your trusted health tips, Grandpa's wisdom. If you're over 60, don't ignore these silent health warning signs. After 60, your body becomes quieter, not weaker, just quieter. Many serious health problems don't begin with pain. They begin with small, silent signals most people ignore. Watch this full video. You will get benefits for health. Let's start. As we age, the body changes how it communicates problems. Pain signals become less sharp and symptoms appear more subtle. Instead of loud warnings, the body sends quiet messages. This is why serious conditions can develop slowly without obvious signs. Understanding these silent signals becomes essential for protecting your health after 60. Many people over 60 assume small changes are just aging. They ignore fatigue, minor pain, or unusual feelings. But these small changes are often the earliest warnings. Dismissing them delays diagnosis and treatment. Paying attention early can make a life-saving difference. Feeling tired occasionally is normal, but constant fatigue is not. If your energy drops without a clear reason, your body may be struggling internally. This could signal heart issues, anemia, or metabolic problems. Persistent fatigue is one of the most ignored warning signs. If your walking feels slightly unstable or slower than usual, don't ignore it. Small balance changes can signal nerve, brain, or circulation issues. Many serious conditions begin with subtle movement changes. Your body is signaling that something needs attention. Breathing should feel natural during daily tasks. If you notice shortness of breath while walking or climbing stairs, it may indicate heart or lung stress. This is often ignored until it becomes severe. Early attention can prevent major complications. Heart problems don't always begin with sharp pain. Sometimes it feels like pressure, tightness, or discomfort. Many people ignore it because it doesn't feel serious. But even mild chest sensations should be taken seriously after 60. Sleep changes can reflect deeper health issues. Difficulty falling asleep, waking frequently, or feeling unrested may signal stress, heart issues, or neurological changes. Sleep is a window into your overall health. Ignoring it can hide bigger problems. A sudden lack of appetite is not always normal. It can indicate digestive, metabolic, or even serious systemic issues. If food no longer feels appealing without a clear cause, your body may be signaling imbalance. Occasional forgetfulness is normal, but consistent changes are not. Struggling to recall familiar things or losing track of conversations may signal early cognitive decline. Early awareness allows better management and care. Swelling in the lower body is often ignored, but it can indicate heart, kidney, or circulation issues. Even mild swelling should not be dismissed. It's a visible sign your body is holding onto fluid abnormally. Heart problems rarely begin with dramatic symptoms. Instead, they develop slowly with subtle changes in how your body feels. Many people expect sudden pain, but the truth is often much quieter. The heart sends small signals long before serious events occur. Recognizing these early signs can prevent life-threatening complications. If simple tasks like walking or light chores suddenly feel exhausting, it may be more than aging. The heart may not be pumping efficiently, reducing oxygen supply to muscles. This causes fatigue much earlier than expected. Many people ignore this shift until it becomes severe. Cold extremities can be a sign of poor circulation. When blood flow is reduced, your hands and feet receive less warmth. This may indicate narrowing blood vessels or heart inefficiency. It's a small but important signal often overlooked. A fluttering sensation in your chest may seem harmless, but it can signal an irregular heartbeat. These rhythm changes affect how efficiently blood is pumped. Occasional irregularity should not be ignored. Especially after 60, early detection can prevent complications like stroke. Feeling dizzy when standing up may indicate blood pressure, instability. This means your heart and vessels are struggling to adjust quickly. While it may feel minor, repeated episodes can signal deeper cardiovascular issues. It's a warning worth paying attention to. If small cuts take longer to heal, your circulation may be compromised. Blood carries oxygen and nutrients needed for healing. When flow is reduced, recovery slows down. This can be an early sign of vascular or blood-related problems. Changes in skin color can reveal oxygen issues in the blood. Pale or slightly bluish tones may indicate poor circulation or low oxygen levels. These changes are often subtle but important. Your skin can reflect what's happening inside your body. Swelling that appears and disappears may seem harmless, but it can indicate fluid retention linked to heart or kidney function. Even if it's temporary, it should not be ignored. These small changes often signal bigger issues developing. If you notice you can't do as much as before, your heart may be under strain. Reduced endurance is often one of the earliest signs of cardiovascular decline. Many people blame aging, but it's often more than that. Your body is signaling reduced efficiency. High blood pressure is called the silent killer for a reason. It often has no obvious symptoms until serious damage occurs. Regular monitoring is essential after 60. Ignoring it can lead to heart attack, stroke, and kidney damage. The brain communicates differently than other organs. Its warning signs are often subtle and easy to dismiss. Many people assume these changes are just part of aging, but in reality, they can signal early neurological issues. Recognizing them early allows for better protection and care. Forgetting small things occasionally is normal, but repeated memory lapses, like missing appointments or forgetting familiar names, can be a warning sign. These patterns may indicate early cognitive decline. Paying attention early can help slow progression and improve quality of life. Struggling to find the right words during conversation is often overlooked. If it happens frequently, it may indicate changes in brain function. Communication relies on strong neural connections. When those connections weaken, speech becomes affected. Unexpected mood swings or personality shifts are not always emotional. They can reflect changes in brain chemistry or function. Increased irritability, anxiety, or withdrawal may signal neurological imbalance. These changes deserve attention, not dismissal. If it becomes difficult to focus on simple tasks, your brain may be signaling stress or decline. Concentration requires coordination between multiple brain areas. When this coordination weakens, mental clarity suffers. This is often an early warning sign. Tingling or numbness may seem minor, but it can signal nerve damage. This could be related to circulation, diabetes, or neurological issues. Persistent sensations should not be ignored. Your nerves are sending important messages. Blurred vision, double vision, or sudden difficulty seeing clearly can indicate brain or nerve issues. Vision is closely linked to neurological function. Even temporary changes may signal something serious. Immediate attention is important. Dropping objects or feeling clumsy may not be random. Coordination depends on brain and nerve signals working together. When these signals weaken, control decreases. This can be an early neurological warning sign. Occasional headaches are normal, but frequent unexplained headaches are not. They may signal changes in blood flow or brain pressure. Ignoring them can delay diagnosis of serious conditions. Patterns matter more than intensity. If you feel your thinking has slowed down, it's worth paying attention. Processing information more slowly can be an early cognitive signal. Many people dismiss it as aging, but it may indicate underlying changes. Early awareness leads to better outcomes. Digestive issues often start small and quietly. A little discomfort, mild bloating, or occasional irregularity may seem harmless. Many people assume it's just something they ate, but your digestive system is deeply connected to overall health. Small changes can signal bigger problems developing inside. Occasional bloating is normal, but frequent bloating is not. It can indicate digestive imbalance, food intolerance, or even organ-related issues. When bloating becomes regular, your body is asking for attention. Ignoring it delays important diagnosis. Sudden changes in bowel habits should never be ignored. Constipation, diarrhea, or irregular patterns may signal digestive disorders. These changes reflect how well your body processes waste. Consistent changes deserve medical attention. Losing weight without trying may sound positive, but it can be a warning sign. It may indicate issues with digestion, metabolism, or serious illness. The body may not be absorbing nutrients properly. Unintentional weight loss should always be evaluated. Feeling full quickly or losing interest in food can signal digestive or systemic problems. It may indicate stomach or liver issues. Appetite changes are often early warning signs. Paying attention can prevent serious complications. Frequent heartburn is more than just discomfort. It may indicate acid reflux or damage to the esophagus. Over time, this can lead to serious complications. Regular symptoms should not be ignored or self-treated indefinitely. Changes in stool color can reveal internal issues. Dark, black, or very pale stools may indicate bleeding or liver problems. These signs are often overlooked due to discomfort discussing them, but they are critical signals your body sends. A slight yellow tint in the skin or eyes can signal liver problems. This condition, known as jaundice, indicates that the body is not processing waste properly. Even subtle changes should be taken seriously. Early detection is key. Persistent abdominal swelling or discomfort should not be ignored. It may indicate organ enlargement, fluid buildup, or digestive issues. Even mild but consistent discomfort matters. Your body is signaling internal stress. Changes in urination can signal kidney or metabolic problems. Frequent urination, dark color, or unusual smell are important clues. The kidneys play a key role in overall health. Paying attention to these changes is essential. After 60, as we age, the immune system becomes less responsive. It doesn't react as strongly or as quickly as before. This means infections may not cause obvious symptoms right away. Instead of strong signals like high fever, the body may respond quietly. Understanding this helps you catch problems earlier. Getting sick more often than usual is a warning sign. Frequent colds, coughs, or minor infections suggest your immune system is struggling. These repeated illnesses should not be ignored. They indicate reduced defense against harmful organisms. If it takes longer to recover from common illnesses, your immune system may be weakened. Healing that once took days may now take weeks. This delay is an important signal. Your body is having difficulty fighting back effectively. A mild fever that appears occasionally can be easy to ignore, but it may indicate ongoing infection or inflammation. The body is trying to fight something internally. Even low-grade temperature changes matter after 60. When the immune system is constantly active, it drains energy. This leads to ongoing fatigue without a clear cause. Many people mistake this for normal aging, but it may signal chronic inflammation or hidden infection. Body aches without physical exertion may indicate immune response. The body releases chemicals to fight infection, which can cause discomfort. If aches persist without reason, they should be evaluated. These are often early warning signs. Lymph nodes help filter harmful substances in the body. Swelling in the neck, underarms, or groin may indicate infection. These changes are often painless and overlooked, but they are important signals from your immune system. Skin problems can reflect internal immune health. Infections, redness, or wounds that heal slowly may signal weakened defenses. The skin is your body's first barrier. When it struggles, it often reflects deeper issues. Repeated infections in the urinary or respiratory system are not normal. They may indicate reduced immune protection. These infections often return if the root cause is not addressed. Early intervention is key. If symptoms persist or repeat frequently, it's time to act. Ignoring them allows problems to grow silently. Early medical advice can prevent complications. Your immune system is always communicating. Listen carefully. Hormones control nearly every function in your body, from energy to mood. After 60, hormonal shifts happen gradually and quietly. Unlike sudden illnesses, these changes creep in over time. That's why they're often mistaken for normal aging. But recognizing them early can protect long-term health. Sudden weight changes without changes in diet or activity can signal hormonal imbalance. Your metabolism may be slowing or becoming irregular. This affects how your body stores and uses energy. Ignoring these changes can lead to more serious conditions over time. Feeling tired even after a full night's sleep is not normal. Hormonal imbalances, especially related to thyroid or blood sugar, can drain energy. This type of fatigue feels deep and persistent. It's a signal your internal systems need attention. Feeling unusually thirsty and needing to urinate more often can be early signs of blood sugar imbalance. These symptoms are often linked to diabetes or metabolic disorders. They may seem minor at first, but can progress quickly. Early awareness is critical. If you suddenly feel too cold or too hot compared to others, your thyroid may be involved. Hormones regulate body temperature and metabolism. Changes in sensitivity can signal imbalance. This is often overlooked but very important. Hormonal health affects your skin and hair. Dry skin, thinning hair, or changes in texture may signal imbalance. These changes happen slowly, making them easy to ignore, but they reflect deeper internal shifts. Hormones strongly influence emotions. Sudden mood swings, irritability, or anxiety may not be just emotional. They can be linked to hormonal fluctuations. Understanding this helps reduce confusion and improves management. Metabolism controls how quickly your body repairs itself. If healing slows down, your metabolic system may be struggling. This affects recovery from even minor injuries. It's a subtle but important warning sign. Gaining fat around the abdomen without changes in diet or activity can signal hormonal imbalance. This type of fat is closely linked to metabolic and heart risks. It's more than a cosmetic issue. It's a health signal. Hormonal and metabolic issues develop slowly but impact the entire body. Catching them early allows for better management and prevention. Ignoring them leads to long-term complications. Awareness is the first step to control. Mobility doesn't disappear suddenly, it declines slowly over time. Small changes in movement, flexibility, and strength are often ignored. Many people assume it's just aging, but these early signs are your body asking for support. Recognizing them early helps preserve independence. Feeling stiff when you wake up may seem normal, but persistent stiffness is not. It can signal joint inflammation or early arthritis. If stiffness lasts longer or becomes frequent, it needs attention. Early care can slow progression. If opening jars or holding objects becomes harder, it may indicate muscle or nerve decline. Grip strength is a key indicator of overall muscle health. Weakness here often reflects broader physical changes. It's a subtle but important signal. Muscles should recover quickly after light activity. If you feel tired or weak after simple tasks, it may indicate muscle loss. This condition, known as sarcopenia, develops quietly. Early awareness helps maintain strength and mobility. Balance problems often begin subtly. A slight wobble or hesitation while walking can signal muscle or nerve issues. These small changes increase fall risk over time. Addressing them early is essential for safety. Chronic back pain without a specific cause may indicate bone or muscle issues. It could be related to posture, disc changes, or muscle weakness. Persistent discomfort should not be ignored. It often reflects underlying structural changes. Gradual loss of height can indicate bone thinning or spinal compression. This is often linked to osteoporosis. Many people don't notice until it becomes significant. Monitoring height changes can reveal early bone health issues. Swelling or mild pain in joints may signal inflammation. Even if the discomfort is manageable, it should not be ignored. These early signs often lead to more serious joint conditions. Early care can reduce long-term damage. Walking slower than usual without a clear reason can indicate declining strength or coordination. It may reflect changes in muscles, joints, or even the nervous system. This subtle shift is an important health indicator. Speed often reflects overall vitality. Mobility is directly linked to independence and quality of life. Small declines today can lead to major limitations tomorrow. Paying attention early allows you to stay active longer. Protecting movement means protecting your freedom. Your skin is not just a surface, it is a reflection of what is happening inside your body. Changes in circulation, hormones, or nutrition often appear on the skin first. Many internal problems show visible signs before other symptoms appear. That's why skin observation is medically important after 60. If your skin becomes unusually dry or begins to crack, it may signal dehydration or hormonal imbalance. Sometimes it reflects thyroid or metabolic issues. Moisturizers alone may not solve the root cause. Persistent dryness deserves attention. Skin color changes can reveal circulation or organ issues. Pale, bluish, or yellow tones are especially important. These changes often indicate oxygen or liver-related concerns. Even subtle shifts should not be ignored. If small cuts or wounds take longer to heal, it may indicate poor circulation or blood sugar imbalance. Healing requires oxygen and nutrients delivered through blood flow. When this process slows, it signals internal issues. This is a key warning sign. Bruising easily or without clear reason can indicate fragile blood vessels or blood-related issues. It may also reflect vitamin deficiencies. These changes should not be ignored, especially if they become frequent. They often reveal internal imbalances. Hair health is closely linked to hormones and nutrition. Sudden thinning or increased hair loss may signal thyroid issues or metabolic imbalance. While gradual changes are normal, sudden shifts should be checked. Your hair reflects internal stability. Nails can reveal nutritional deficiencies or circulation problems. Brittle, discolored or ridged nails may signal internal imbalance. These small changes are often overlooked, but they are valuable diagnostic clues. Itching without visible rash may indicate internal issues such as liver or kidney imbalance. When no external cause is present, the signal often comes from within. Persistent symptoms should always be evaluated. Your body is communicating internally. Swelling in the face, hands, or feet may indicate fluid retention. This can be linked to heart, kidney, or liver function. Even mild swelling should not be ignored if it persists. It often reflects internal system strain. External changes often appear before serious internal symptoms develop. The skin, hair, and nails are early warning systems. Paying attention to them allows earlier intervention. Your body often shows the truth before you feel it. Sleep is one of the most accurate indicators of overall health. It reflects how your brain, heart, hormones, and metabolism are functioning. When something goes wrong internally, sleep is often affected first. That's why doctors pay close attention to sleep patterns after 60. Struggling to fall asleep may indicate stress, hormonal imbalance, or nervous system changes. It can also reflect poor circulation or metabolic shifts. Occasional sleeplessness is normal, but persistent difficulty should not be ignored. Your body may be signaling imbalance. Waking up multiple times during the night disrupts deep sleep cycles. This can affect heart health, memory, and immune function. It may be linked to breathing issues, stress, or internal discomfort. Quality sleep matters more than total hours. If you wake up feeling tired despite sleeping enough hours, something may be affecting sleep quality. This can be linked to heart strain, breathing issues, or metabolic imbalance. Restful sleep should restore energy. When it doesn't, it's a warning sign. Excessive sleepiness during the day is not always normal aging. It can indicate poor nighttime sleep quality or underlying health issues. If you frequently feel drowsy during simple tasks, your body's asking for attention. Energy regulation may be disrupted. Energy that fluctuates without reason may signal hormonal or metabolic imbalance. Some days feel normal, others feel extremely weak. This inconsistency often reflects internal instability. Your body's energy system is not functioning smoothly. Morning should be your most energetic time. If you wake up feeling weak or drained, it may indicate poor sleep quality or internal imbalance. This is often one of the earliest signs of declining health. Morning energy is a key indicator. Losing track of time or having irregular daily rhythms may reflect changes in brain function or sleep cycles. The body relies on internal clocks to regulate health. When these rhythms are disrupted, multiple systems are affected. Poor sleep directly affects mood and emotional stability. Lack of deep rest increases irritability, anxiety, and stress sensitivity. Emotional changes are often rooted in sleep disruption. Improving sleep can improve mental balance. Sleep is deeply connected to every major system in the body. Changes in sleep often appear before physical symptoms. Paying attention to these patterns allows early detection of health problems. Your sleep is one of your body's most honest signals. Circulation problems rarely begin suddenly. They develop slowly as blood flow becomes less efficient. At first, the signs are so mild that they are easy to ignore. But over time, these small changes can lead to serious heart and vascular issues. Recognizing them early is essential after 60. If your hands and feet feel cold, even in comfortable temperatures, it may indicate reduced circulation. Blood is not reaching extremities efficiently. This can be an early sign of vascular narrowing or heart inefficiency. It should not be ignored if it happens regularly. A simple test is pressing your fingernail or skin and watching how quickly color returns. If it takes longer than usual, circulation may be reduced. This reflects how efficiently blood is flowing through your body. It is a subtle but important indicator. Feeling lightheaded when standing up can indicate blood pressure or circulation imbalance. The brain may not be receiving blood quickly enough. This symptom is often brushed off as normal aging, but repeated episodes should be taken seriously. Swelling in the legs after short periods of standing or walking may indicate poor circulation. Blood and fluids may be pooling in the lower body. This can reflect heart or vein-related issues. Even mild swelling deserves attention. If your body takes longer to recover after simple activities, circulation may be weakened. Muscles need oxygen-rich blood to recover properly. When flow is reduced, recovery slows down noticeably. This is a hidden warning sign of cardiovascular decline. Chest tightness during walking or light effort is never normal. It may indicate that the heart is not receiving enough oxygen. Even mild discomfort should be taken seriously. Early recognition can prevent serious complications. Changes in vein visibility or pattern may indicate circulation issues. Bulging or unusual vein appearance can reflect pressure changes in the vascular system. These changes should be observed, especially if new or increasing. Feeling exhausted after simply standing still may indicate poor blood flow. The heart must work harder to maintain circulation. This symptom is often ignored but reflects deeper cardiovascular strain. It should not be overlooked. The most important warning signs are not dramatic, they are daily changes. How you feel while walking, standing, or resting reveals your circulation health. Paying attention to these small signals allows early action. Your body speaks every day. Listen carefully. Not all medical emergencies begin with severe pain. Many start with mild, confusing, or temporary symptoms. Because they don't feel dramatic, people often ignore them. But these small signs can be the body's final warning before a serious event. Recognizing them early can save lives. If one side of your body suddenly feels weaker than the other, it may be a serious neurological warning. This could indicate a stroke beginning. Even if the symptom disappears quickly, it must never be ignored. Immediate attention is critical. Confusion or trouble forming words suddenly is a major warning sign. It may indicate reduced blood flow to the brain. Speech disruption should always be treated as urgent. Time is extremely important in these situations. A sudden change in vision, even if temporary, can signal a serious vascular issue. It may indicate reduced blood flow to the eyes or brain. This should always be evaluated immediately. Vision changes are never random. Chest pressure that appears suddenly or becomes intense should never be ignored. It may indicate a heart attack or a serious cardiac strain. Even if it improves, it still requires urgent medical evaluation. Acting quickly is essential. A sudden, intense headache, unlike anything before, may be dangerous. It could indicate a vascular issue in the brain. This type of symptom should never be treated as normal. Immediate attention is necessary. Sudden inability to walk properly or maintain balance can indicate neurological disruption. This may be an early stroke or brain circulation issue. Even if it improves quickly, it should not be ignored. It is a critical warning sign. If breathing becomes difficult even while resting, it may indicate heart or lung distress. This is not normal fatigue. It can signal fluid buildup or cardiac stress. Immediate evaluation is very important. Fainting or feeling like you might faint is a serious warning. It may indicate sudden drops in blood pressure or heart rhythm issues. Even a single episode should not be ignored. It requires medical attention and emergency warning signs. Time is critical. Delay in action can increase risk significantly. Even if symptoms disappear, the cause may still be present. Acting quickly protects the brain, heart, and life itself. After learning all these warning signs, the most important thing is not fear, it is awareness. Fear can overwhelm you, but awareness protects you. When you understand your body, you can respond early and correctly. Knowledge is the first step toward prevention and control. Your body never hides problems completely. It always sends early signals in small ways. Fatigue, discomfort, or subtle changes are messages, not coincidences. Learning to recognize them gives you an advantage in protecting your health. The most powerful health habit after 60 is regular paying attention to your daily energy, sleep, movement, and digestion can reveal early problems. This simple habit can prevent serious conditions from developing unnoticed. Even if you feel healthy, regular medical checkups are essential. Many conditions develop silently without obvious symptoms. Early detection through checkups can make treatment easier and more effective. Prevention always works better than reaction. You don't need extreme changes to improve health. Small habits like walking, balanced eating, hydration, and rest make a powerful difference over time. Consistency matters more than intensity. Every small step supports long-term health. Many people ignore their body's signals because they are busy or unsure, but learning to listen is a skill that improves with practice. The more you pay attention, the clearer the signals become. Your body is always communicating. The best treatment is prevention. When you act early, many serious conditions can be avoided or controlled. Prevention is not complicated. It is about awareness, routine care, and healthy habits. This approach protects your independence and quality of life. Movement is one of the most powerful protectors of health. It supports the heart, brain, joints, and metabolism. Even light daily activity improves circulation and energy. Staying active is one of the simplest forms of protection. Stress and emotional strain affect physical health more than many people realize. Calmness supports heart health and immune strength. Taking care of your mind is just as important as caring for your body. Both are deeply connected. Your body has supported you for many decades. Now it deserves your attention and care. Do not ignore small signals say are early protection, not problems. Stay aware, stay active, and stay connected to your health. Your future depends on what you notice today. If this video helped you understand your body better, then remember this: your health is not something to guess, it is something to observe. Subscribe to Dr.Grandpa for simple, clear, and life-protecting health guidance, made especially for seniors. Take care of your body because it has taken care of you your entire life.